Okay, and we're live. Hello, everyone. Welcome to the webinar on NCDs, which is hosted by the SCOF. I'm very, very happy to welcome you to the webinar. NCDs is a SCOF priority, and this is a part of the SCOF webinars and manuals release week that we're having. So before I dive into the agenda, I'm going to ask you to introduce themselves, and then we can dive in. Sana, would you like to go first?
Of course. Hi, everybody. I'm Sana. I'm from the Netherlands, and currently I'm the liaison for public health issues, which makes me responsible to work on non-communicable diseases on the external representation level in IFMSA.
Maybe I can go next. My name is Marie, and last year I was the Vice President for External Affairs of IFMSA, and I've also been the liaison officer to the World Health Organization previously. But, now I'm in the. Now I'm a member of the NCD Child Governing Council, and doing a lot of work on NCDs, and also I've been an intern at the NCD Global Coordination Mechanism at WHO. And then, during my time in IFMSA, I also worked a lot on NCDs through my various positions. Thank you.
I just dropped in before. Chris, have you introduced yourself? Okay, perfect. Thank you. So now I'm going to share my screen, and we're just going to dive in into the agenda and see how the webinar is going to go. Motion in general. Then we're going to talk something specifically about the social determinants of NCDs. Then Marie is going to be talking about youth and non-communicable diseases. Sana is going to be talking about the global processes and external stakeholders on NCDs. And then I'm going to end the webinar by introducing you and giving you a sneak peek of the manual on cardiovascular diseases, which we're working on and is due to be released, and just example of some activities on NCDs. So I'm going to leave the floor to Chris. Chris, would you like to go ahead?
Sure. I can't see the presentation.
Just a second, sorry.
Okay. By the way, I can be introducing myself. Hello, everyone. My name is Christophe Juarez, and hi. I'm the SCOF Regional Assistant for Africa at International Federation of Medical Student Associations, IFMSA. So, as we kick off, we start with the introduction to NCDs and global burden. NCDs, simply, these are disease, the non-communicable disease which is not passed by one person to another, or a disease which does not result from an acute infectious process. And these include the disease due to chronic infections. Examples are like cervical cancer, which is caused by HPV, HS, herpes simplex virus, which stands for sarcoma, Kaposi sarcoma, and there is also EBV or Epstein virus, which is responsible for non-Hodgkin lymphoma. These are the main cancers caused by a chronic infection. And when we talk about non-communicable diseases, it is simply which is not passed from one person directly in an acute process. So the disease has the main three characteristics, which is prolonged course, it takes long to develop, and does not resolve spontaneously, and it's difficult to achieve complete cure. Next slide. These diseases are many, but the meaning that there are many. We include the mental health disorder, which have been overlooked in ages, but they are now a very big global issues. But looking at how they kill people, we can classify them into the main 4 groups. Number 1, top killing disease are cardiovascular diseases. These are a group of diseases including hypertension, ischemic heart disease, stroke, and so many. This disease is responsible of 24% of all total global deaths, around 17 millions. And we have also cancers, number 2, which is killing around 8 millions. We also have chronic disease, respiratory disease, which is also killing about 4 millions per year. And the last is diabetes, which is around 2 or 1 millions death per year. Next slide. So about the global burden of a disease, NCDs account for 70% of all global deaths. It means 41 of 57 million of total global deaths. And these are projected to increase up to 52 million in 2030. So what is surprising, 80% of these NCDs occur in low and middle income countries. And of course, more than 15 million are premature death between ages of 30 and 70 years. Most of these premature deaths can be prevented or delayed. Like 80%, you can prevent the non-communicable diseases. Next. So there is also what we can call risk factors. They are not really the causes, but they are risk factors. When we define a risk factor, we define it as an aspect of personal behavior or lifestyle, an environmental exposure or hereditary characteristics that is associated with an increase in the occurrence of a particular disease, injury, or other conditions. And these risk factors are mainly classified into 2. Number 1 is modifiable risk factors. Non-modifiable risk factors. Non-modifiable risk factors account for 20% of all the risk factors. These include age, gender, race, genetics. Even though we can't modify them, but it's crucial to know them, even though they are counting less percentage. So the number 2, which stands for 80% of all the cause of the 4 main NCDs, they are called the modifiables. The 4 diseases are caused by 4 modifiable risk factors, mainly at 80%. So these include tobacco, unhealthy diets, physical inactivity, and harmful alcohol use. And tobacco is responsible for both of the 4 non-communicable diseases, including chronic respiratory diseases. So this is really a global health issue, since tobacco it occupies tobacco is killing around 1/6 of the total global death of the 41 million we have stated above. Next slide. So there is a lot of some specific ways in which you can prevent NCDs, which is number 1 is promoting healthy lifestyles. And we can promote the healthy lifestyles by promoting healthy diet, avoiding fat, salty food, and so on. By quitting smoking, by also promoting physical activity, doing sport. We can also promote the we can also promote daily lifestyles by avoiding heavy alcohol use. And of course, as I said, tobacco is among the top risk factors which are causing a great number of deaths, like 1.6 million per year. And obesity also is a major problem, since in 2016, around 2 billion adults aged 18 and above were overweight, and this big problem when the and around, yes, it has actually increased, and if we don't do anything about this will cause more problems and contribute to the prospect of having 52 millions of deaths per year in 2030. So the next. So we also have the World Heart Federation has projected has just taken initiative of reducing all those risk factors in what we call global targets by 2015. So this includes to reduce premature mortality by 25%, reducing tobacco use by 30%, harmful alcohol use by 30%, and physical inactivity by 10%, and raised blood pressure at 25 by 25%. Then diabetes, increase in diabetes and obesity 0%, and salt intake reduction by 30%. And these are the main global targets we have, and we are always called to contribute to reduce the burden of cardiovascular diseases and the cancers, the chronic respiratory disease, and the diabetes. Next. And we can also have the social determinants of NCDs. These are basically linked to the social determinant of health we already know. Next slide. And we define social determinant of health as the condition in which people are born, grow, work, live, and age, and the wider set of forces and health system that shapes the condition in our daily life. And those wider forces may include policies, health systems, and development agenda, and social norms, including cultural norms. And they are grouped in like 4 to 5 groups. These include general socio-economic and cultural environmental conditions. And this point is all about education, work, employment, living and working conditions, water, sanitation, maternal care, health care services, and housing, and so on. Then there's number 2, social and community networks, how people interact with each other, how rich family can keep being always rich, others are still below. And there is also the individual lifestyles factors. These include those non-modifiable like ages, sex, and health, hereditary factors. Second, yes. According to WHO, we have 9 examples recognized by the WHO as a social determinant of health. This includes social gradient, which is all about socio-economic status, the stress, how life makes you, how life is treating you, the early life, about childhood, and social exclusion or inclusion, unemployment, social support, addiction like drugs, tobacco, alcohol, sugars, food, and yes, about nutrition, malnutrition, overnutrition. And also the last one is transport. This is all about exercise. Yes, next. So NCDs are also linked with this social determinant of health, and that's why we have to talk about the social determinant of NCDs. So these they are linked to our health systems, they are linked to our cultural practices, are linked to our to the poverty, lower levels of education, uh, lower standards of housing, poor neighborhoods, unemployment, and these are what we are going to talk about next. But also uh, putting an emphasis on poverty. Poverty leads to lack of health access, less of opportunities for employment, lack of health education, and lack of social inclusion. And poverty is almost universally linked to higher rates of smoking, alcohol consumption, obesity, and NCDs. As a summary on social determinant of health, poor social determinants increase higher risk of illness, lower chance of suitable health care access, and yes, and so on. But we can also think of how we can address social determinants of health. Addressing social determinants of health and who needs to be involved. This requires working on all causes of loss of health in society. We can't continue to only treat the rising diabetes, heart disease, and so on, which require more social investment. And we can also address issues such as lack of education around prevention, rising mental health burden caused by socioeconomic hardships, and unaffordable housing and health care. The WHO report on social determinant of health states that NCDs cannot be effectively addressed without action on social determinant of health. Without addressing social inequalities and conditions, along with the reasons some health systems work better for some people than others. And if we don't do this, prospect of reversing NCDs epidemics will be poor. Next slide. Then we can talk about more about health system and as social determinant of NCDs. So when we define health systems, we mean that it's all organizations, people, institutions producing actions whose primary intention is just to promote, restore, and maintain health. Health systems affect NCDs health outcomes in many ways, and this can generate inequalities in terms of access, utilization, and equality. And when we talk about access is just it's if the services are available, accessible, and again affordable by everyone, and this also include insurance. The health utilization, the utilization is stand for it's all about the health literacy, and this health literacy is also told to be by as one of social determinant of health, because it's all associated with several adverse effects, outcomes, like lower knowledge about the health services provided, lower disease prevention, higher hospitalization. So because people they don't know if this can be treated at primary or secondary or tertiary level, So this is affecting and putting people into financial hardships. And also it leads to poor health status in general. And when we talk about the quality, this is about the long waiting times for people who are visiting healthcare services, and due to the problem of doctors, I mean the low number of healthcare workforce, it's affecting our health system, and also affecting our social determinant of health. And the number two on quality, it results to burnout. It results from burnout due to working of capacity of doctors. Hence, this relates to poor quality of services, which results to poor health outcomes. I think the next point is going to be for Mishwa, which is culture and the social determinant. But before, we can also talk about the 6 building blocks of health system recognized by WHO. So these include health governance, health financing, and health workforce, medical products, technologies, procurement, things like that, and information, how data are recorded, including research, how academics and different institutions are contributing to evidence-based practice, and also service delivery. These are the main 6 building blocks of health systems. Where in different countries, there are also, when we talk about health systems, there are some levels of health system. Most of the countries have the primary, what we call primary level, at which we can prevent around 80% of NCDs, and also secondary level, which is includes health center. Yes, the secondary, the tertiary level. There are I don't know, for people. Some people have quaternary level, but it's rare. That's all about the levels of health system, and these all work together to contribute to high quality health care in for all the country, including low, middle, and high income countries. Thank you very much.
Thank you very, very much, Chris. So I'm going to go on to the next point, which is a part of the social determinants for NCDs, as culture as the social determinant of NCDs. So I'm just going to start with the definition of culture and seeing what culture is. So culture is a combination of knowledge and experiences that people have, what they believe in, what values they hold, what are their attitudes, their perceptions. It is also influenced by religion, what is the role that they play in their society, what are their relationships, their concepts of the universe, basically everything. In a nutshell, however you practice or however you live is very much dependent upon your culture, which could be manifested by your beliefs or a very big social determinant of health disease for any sort of public health issue or for any disease. So we're just very briefly going to go over a bit of examples on how culture influences, or how culture is very tangibly related and a social determinant of NCDs. So starting with the impact of culture and NCDs and health outcomes, the first thing which we need to ask about while considering culture as a part of the bigger picture in NCDs is, firstly, how does the community define health? And how do they define illness? What is their threshold of illness when they think that they are going to go and visit a hospital? And then are they knowledgeable enough that they understand their illness? Do they know that salt will cause hypertension, so they will not intake it? Or do they know as to their not only factors of lifestyle, but also other risk factors? that influence them, or do they know that if they have a family history of it, then they would be more prone to it? Then the next thing is, are they able to choose the best treatment option for them, which is in line with their beliefs, and not only in line with their beliefs, but also which is practical for them and applicable for them. Then the next thing is adhere to their treatment plan. In this, there are a couple of things. Firstly, do they have the resources to access a treatment plan, to afford medicines? So especially in low-income countries, the country that I come from, this is a very big issue, as to people are not able to adhere to the treatment plan just because of the mere cost of the treatment plan. And the second thing is, do they consider treatment plan as a priority? Do they give it the time and importance, or do they put other things over priority? Or do they not understand the importance of treatment, or do they not understand the importance of threats that NCD poses to them? The next thing is, can they seek out preventative medicine, which is not only from the patient side, but also from the government side to make it available? Of preventative medicine or not. The next thing is their experience and the expression of pain has to really show it. And this is a very big factor as to when do they call out for help, or when is their threshold when they call it. So NCDs basically are not acute diseases, they're more chronic diseases, which gradually increase over the period of time. And this plays a very important role in that. The next thing is stigma regarding certain behaviors or medical conditions, social acceptance, and family acknowledgement. Mostly, we do not really consider NCDs as an issue which is stigmatized, but it definitely is. I can give you one very real example from first-hand experience in my country, that even such a stigma as to marginalizing people with NCDs or putting the blame on them for their health is to an extent a stigma. When people stop talking about it, or when people do not, this leads to less acceptance, etc. The last thing, which is related to the impact of culture in NCDs, is the relationship with healthcare professionals, which is again very, very important. As to, does the doctor impose the treatment plans, or does the doctor impose his views on a patient, and the patient does not want, it's not a healthy relationship, and the patient does not want to seek more help, etc. Or is it a more healthy relationship where it is more of a dialogue and discussion, and where the patient feels comfortable with discussing the culture and realizes that the professional is taking into consideration everything as to where they live, as to what their socioeconomic situations are, as to what their even beliefs are. And that, of course, leads to better treatment of NCDs, and even leads to a higher chance of preventing NCDs with spreading of knowledge. So I'm going to move on to Youth and NCDs by Marie. Marie, would you like to take over?
Yeah, thank you. So this is Marie speaking. I'm not sure if you can see me, but I hope you can see my slides. And I've been asked to talk about youth and NCDs. And I think it's since I've worked on it before, but also I just wrote this article together with another guy that I'll try to get out to you so you can see it if you are interested. But basically, I think, in my opinion, youth and NCDs is a very important area for us as young people, and especially as medical students, that we can act for and we can advocate for it. We have a high chance, I think, of having impact, both by being young and sort of advocating for our own generation's health, and also we have a vested interest really in our future generations, right? If some of us are going to have kids, we want our kids to grow up in a healthy environment where they have less NCDs and all of these goals that Christopher so well explained before. Next slide. Yeah. So usually I'm sort of thinking of youth and NCDs in two different categories, both youth as the patient, or youth as the patient at risk, or the person at risk of developing an NCD, and then youth as the change maker. And I think a lot of us fall into the category of change makers, but maybe some of us are also already patients or at risk, and this can even make us a stronger advocate, I think, and even more of a change maker. I've met quite a lot of people with type 1 diabetes, for example, in this community, and they really get the message across, and the politicians are definitely listening whenever they're speaking. So these are sort of the two, and I'll try to go a bit more into the youth as patient or at risk first, and then into the change maker afterwards. Next slide. So youth living with NCDs, I've called this first slide, and that's just a few statistics around about youth living with NCDs. So actually, in high-income countries, leukemia is the fifth biggest killer, and iron deficiency amongst adolescents. And adolescence is from 10 to 19 years old. So those of you that haven't worked so much with adolescents, this is actually an interesting field, I think, with youth and NCDs, because often in IFMSA, it's SCORA that works with adolescents and adolescent health, but it's really super relevant to NCDs as well. So maybe worth looking into a bit about adolescent health as well if you're interested in this topic. And then around iron deficiency anemia is the leading cause of DALYs lost in adolescence. And iron deficiency anemia can also be seen as an NCD because it's not communicable, but it's also but at the same time it's not one of the big four. Then there's diabetes type 1, as we all know, and then stroke, asthma, skin diseases, and ischemic heart disease. Actually, young people also suffer from these diseases, etc. And the way these issues are generally perceived is that the problems with these are access to diagnostics, access to healthcare, and access to treatment. And these are political issues as well, but also health systems issues. Yeah, next slide, please. And then moving on to youth at risk of NCDs, and this is something that interests me quite a lot, I must say, because childhood and adolescence is really key to establishing a healthy life, and that's where you form your brain, it's where you form your body, it's where your base metabolism is kind of established during these crucial years. So if we have a healthy childhood and adolescence, our chance of living a healthy life without NCDs is so much bigger than if we have an unhealthy life. And there are unhealthy childhood and adolescence, and there are many, many factors that are to take into account to achieve this. And we're certainly off track in many of our countries for several of these issues. And I'm going to give you a few statistics to explain that. So what we see is that 2/3 of preventable adult NCD deaths are actually associated to a risk behavior that started from adolescence. So say that a person starts smoking in adolescence, they have a high chance of actually dying from a tobacco-related disease in adulthood. And this is premature and preventable death. Yeah. Also, more than 150 million young people use tobacco globally. And also at the global level, 84% and 78% of adolescent girls and boys, respectively, are physically inactive. Isn't that insane? Like it's so much. It's a very, very large majority. And then when we look at alcohol, 11.7% are binge drinking. And as Christopher already said, 41 million children under 5 years of age are either overweight or obese at the global level. So clearly there's something that's wrong and something that we're not doing correct at this point. And the issues are societal or political. Basically, the environment that we're living in is not protecting us and is kind of, I think in a lot of ways, is increasing our risk of developing NCDs. And I certainly believe that the individual is not the only responsible party to prevent an NCD and at risk. And in a lot of cases, we see that the individual might have very, very little chance of actually changing its own trajectory towards an NCD. So yeah, poverty has also been mentioned. Food systems, some of the most unhealthy foods are the cheapest. There have been big issues with Nestle and their unhealthy products, and Coca-Cola keeps trying to influence NCD policies at the both national level and also at the WHO level. So yeah, there are many issues here. Prices and fiscal policies. So that's what politicians can do about it, right? They can try to see, okay, we want to implement a tax on some of these unhealthy products so that they will actually reflect the real cost of them. Because the real cost is not just the sugar that you intake today, it's also all of the healthcare outcomes or costs that you will have in the future. So that's part of the cost. But also, if you suffer from an NCD before you stop working, you'll actually be taken out of the job market, and thereby there will be a great cost to your society as well. So there are lots of good arguments for actually adding these taxes. And also, we've just seen in a lot of cases that they work. There are also some real arguments against them, but in a lot of cases there is evidence in favor of fiscal policies. And then also mentioned previously health literacy, understanding what are the consequences of the actions that we do. And then I think it's important to say that adolescents, as much as a potential that they represent, as much they are also vulnerable. And a vulnerable group where they're prone by default, by genetics and by normal development, adolescents are actually very at high risk of having high risk behavior and for developing these not so healthy habits. And that's a normal phenomenon actually that we need to take into consideration when we form new policies. So so basically, there's a lot of talk about prevention here, but we also need to work cross-sector because it's not just about healthcare and prevention in the science of medicine prevention. Yeah, next slide. So youth as changemakers. And I've called it NCD Changemakers because I want to focus it a little bit and not only talk about youth at a general level, sort of trying to influence policy. But I think it's important to draw out this quote, which was from Ban Ki-moon, the former Secretary General of the United Nations. And he said that young people are the world's greatest untapped resource. Adolescence can be a key driving force in building a future of dignity for all. And that's something, it might seem very high level and very far from us, but in some ways it's just super, super important. That's something that the top of the UN has actually said. It's also written in several papers and resolutions from the past in the UN, but it's important that this has been said in a speech. And I think hopefully there will be this sort of, I don't want to use that, but trickle down effect where other politicians also take on this responsibility and this sort of mindset, which is so much needed. Next slide. And yeah, there is definitely more and more movement towards inclusion of young people in the NCD space. And there has been the recognition for the need for, I'm calling it us, but basically I think we can see us as a big group, young people that are sort of mobilizing to create change and to create a healthier population, a global population. And both Tedros, the Director General of the WHO, has said it. NCD Alliance, who is a very, very crucial stakeholder in this NCD community, has put youth as one of the top priorities at their global forum last year. And also some governments are really trying to put this youth and NCDs forward. And we'll also see some side events, which is an important political sort of statement to put out a side event about youth and NCDs, and actually a government is doing this at the upcoming high-level meeting on NCDs in the UN. But despite all of this talk, there is in reality not so much action, and that's where it gets really important. I think there's not that much intergenerational collaboration where the politicians or diplomats are actually listening so much and including us. So it's often tokenized. Our voices as young people are often being dismissed, or we're invited on stage, but actually not to the sessions where we're giving real input in a lot of cases. I think it's changing, and there are so many great youth initiatives and campaigns, and they're at the local level, they're at the national level, and they're at the global level. So change is bound to happen, but we still kind of keep having to push to break that glass ceiling. Yeah, next slide. Which is my last slide, and I just want to briefly talk about who the stakeholders and what young people have actually done in the past. And as you all know, and I think IFMSA is a crucial stakeholder in the NCD space, and that's very much due to our work at the local and national level, where we really, I'm sure many of you have also worked on projects and campaigns and maybe advocacy towards your global or local or national government, trying to change things and trying to give people a healthier life in regards to NCDs. But we've also worked a lot at the external level, and I think Sanne will talk more about that. But last year we did have the Budva Youth Declaration coming out of the March meeting in 2017. And that was actually a very important document in a lot of ways for youth, for advancing this agenda and elevating it, youth and NCDs at the global level. And it was a collaboration with WHO as well. And then I think another important thing that we've done is in IFMSA at the global level is our work within the UNFCCC. So this is where the climate change negotiations happen. And I think where we've really sort of managed to merge two agendas, and we talk about health co-benefits of the changes that are needed within climate change, and then also these are very much sort of, they are benefits for NCDs in a lot of ways, and I think that's super important, and an organization as big as IFMSA has that opportunity to be present and to coordinate, and that's something that at least we were trying to work on last year, and I'm sure Sen is also a lot working on it this year, and that's really important to do, and we as young people, I think we have those minds that can be flexible, and we can break down the barriers, and we don't work in a silo way. We work in a new sort of cross-cutting way, and that's really what our generation should represent. And I think IFMSA is the key stakeholder to do so. Then there's the Young Professionals for Chronic Disease Network, and they were one of the first youth organizations working on NCDs. And what they did in 2007, which is a crazy long time ago, they actually had statins added to the WHO essential medicines list. And that's just something that was really an important recognition of how crucial it was to tackle NCDs, and also in some of the countries where there is a big need for healthcare delivery and for medicine, access to medicines. It was crucial to have statins as one of these drugs, which this list has generally been focused a lot on infectious diseases. And then YP is also very strong in sort of the East Africa. They have chapters there where they're working on some very cool things. There was in one country where their only radiotherapy machine broke down, so no one could get that type of cancer treatment, and everyone was traveling out of the country. But then YP actually mobilized and created an awesome campaign, and actually in the end their minister did commit to getting a new machine. So that was quite incredible. Then there's NCD Child, which does regional capacity building workshops, and then there's NCD Free, which is more sort of on the communication and social media side. And all of these four main stakeholders are trying to influence the upcoming UN high-level meeting on NCDs in 2018, but also national policies, because we all know that these documents that come out from the UN are great, but we need to translate it into policy at the national level and then translate it into action. And I think a lot of countries are stuck somewhere. Some countries have great policies, but they are just not implementing them as well. So I just wanted to sort of end off with saying that there's a huge need for young people, and there's a huge need for young people advocating at all levels of society. And I think we have a very sort of special energy to add to these sort of often quite a similar discussions, and people are used to seeing each other over and over and over again. But we can bring in new ideas, we can bring in some fresh energy, and we really have this deep sort of vested interest in our own lives and our own generation being healthy, but also securing a healthy environment for our future kids to grow up in. So that's what I'll end up saying, and good luck with the August meeting to everyone, and I'm here for questions if any of you have any for me. Thank you.
Thank you very much. Now, Sanne, talking about the global processes and stakeholder NCDs. Sanne?
Yes, thank you. Marie gave a really great speech about talk about how we as youth can and are change makers. And I just want to give you a quick overview of where we are actually doing that. And next slide, please. One of the biggest things that everybody is talking about this year, and Marie also already mentioned, is the third UN high-level meeting on NCDs. And it's going to happen on the 27th of September. So it's in about 2 months from now. And it's quite special for a health topic to make it to this level. So that's why everybody is extremely excited. But as I mentioned as well, it's not the first one. It is going to be the third one. And unfortunately, the first 2 ones didn't have the desired outcome that we all wanted. There were commitments made, but unfortunately never followed up. What is making us hopeful, however, is that in the meanwhile, in 2015, NCDs were also added to the Sustainable Development Goals that you might recognize as the sign on the slides on the left, in which governments already committed to reduce NCD deaths by 1/3 in 2030. And unfortunately, we see now that action taken at this moment will definitely not lead to the 1/3 reduction, but people seem to be motivated to actually get there, to step up. And that is kind of what we hope for, that the outcome will be of this UN high-level meeting. Can I have the next slide? So in preparation, there has been a lot of activities, in all of which youth has tried to make a difference, and IFMC as well. On the top, you see the more formal processes, which are mostly closed off for non-governmental organizations. But fortunately, there was also a lot organized on the sidelines and below. And that is where we, but also other NCD civil society actors, really try to raise ambition and get people excited for the UN high-level meeting, get them committed, and hopefully get a great outcome. At the moment, we only have one thing left. It's only the 27th of September, the actual high-level meeting, although governments are still negotiating. And that also means that we already know a bit about the zero draft, and that will be the actual outcome of the high-level meeting. And it somehow gets us excited. There's a recommitment to the actual goals set in 2011 and 2014, as well as that there's more on mental health, something that was left out a bit of NCD talks before. And there is a re-emphasis on that it's really important for civil society, and also a small mention of young people to be engaged in the NCD debates. However, it's still lacking some things, such as the environment is not mentioned. And as we introduced right now, it is an important thing we think to take into account. And the link wasn't made that much before, but there's growing evidence that actually air pollution is among the 4 major risk factors to get an NCD. And although I said youth is mentioned a little bit, it's not enough yet. So there's still a lot we can do. Next slide. And one way to do that is work with or advocate towards stakeholders. And as Chris and also Marie already introduced to you, NCDs is quite a complicated issue, and a lot of factors contribute to development of NCDs or risk factors to NCDs. So there's a lot of stakeholders that need to be engaged in the NCD fight. But I wanted to highlight 4. First is the World Health Organization. It might speak a bit about itself, but I think in the NCD debates and processes, it's mainly used as a convening power, especially the Global Coordinating Mechanism, which is a special body built within the WHO that convenes a lot of NCD stakeholders and actively engage them, gives them opportunities to sometimes get together, but also resources for training and so forth. And in the lead up to the UN high-level meeting, the WHO has also been really active to get different commissions out there. For example, also a civil society working group to really try to get those voices heard. But maybe more important are the governments, as there is mostly where the decisions happen. And what we really try to get is a whole of government approach. As you heard before from the people who spoke, there's a lot of things we can actually do to prevent non-communicable diseases or to treat them properly. But it's not necessarily something we can do as a health sector on our own. If we want to implement the taxes that Marie spoke about, we need the Ministry of Finance. If we want to do something about air pollution or the environment our children grow up in, we need the Ministry of Environment. If we want to tackle health literacy, we need education and so forth. So it's this moment really trying to get all those people together and get high-level political support to do so. And something that Marie also mentioned is, and that we cannot leave outside of NCDs, is the influence of the industry. So think about the food and beverage industry, tobacco industry, alcohol industry that might have a different side of the story. And while we try to prevent NCDs, that might also get into their sales. But there's also good industries, such as the renewable energy industry, but definitely something to take into account because they can give a lot of backfire to really good initiatives. And last, and maybe most important, I want to address, and I think Marie did a great job already to introduce us to what youth has done as civil society, but there are a lot of other organizations that work alongside organizations such as ours to really try to push the NCD agenda forward. And these are all people that you may be able to engage with, to work with, maybe sometimes also work against if they're against your statement, but at least to take into account. Next. So what can you actually do? The UN high-level meeting is coming up soon, so there's not a lot of time left. But for example, there are a lot of stories collected at this moment, just to show the decision makers how NCDs actually affect our lives and lives around us. And it would be amazing if we have youth voices heard there or voices of future healthcare professionals. So there at the moment are two major collectors of stories. One is WHO, and that's called NCDs and Me. The link is in the slide. And there is the Enough campaign, which is hosted by the NCD Alliance. And it's way more than only stories, but they also are trying to collect voices of change. And it would be amazing if you have anything to say to add yours so we can actually be heard there. Next slide. But of course, you can also organize your own, in brackets, advocacy campaign. And for example, there will be a Global Action Week just before the UN high-level meeting on the 3rd till 9th of September. It is proposed by the Enough NCDs campaign, and they already have a lot of resources available of what you can do. But we also hope that the manual we're going to present is going to give you inspiration, and maybe that way you can also contribute to the Action Week. And something that might be interesting as well is the World Heart Day. It is just after the UN high-level meeting, but that doesn't mean that it stopped there. After our governments made the promises, we definitely need to hold them accountable. So there will be resources becoming available by the WHO and others. And of course, the manual is there again. And Nishra is actually going to tell you more about it. And you can always reach me about questions of the processes and stakeholders and how to actually organize something to speak up.
Sunny, I can't hear you.
I'm done.
Okay. Thank you very much, Sunny. So I'm just going to start with the introduction to, then this is the last part of the webinar. If you have any questions, you can start posting them now. And here's the last part, which we're going to talk about introductions to the introduction to the manuals and the activities. So just giving you a background of as to what work SCOF has been doing in NCDs and into its prioritizations. So SCOF has had NCDs as a priority, as a general priority for as long as we can remember. It's always been on our priority list, internally as well as externally. Internally, this year we had regional priorities and cardiovascular for the region of Africa, which were voted upon by the NPOs. In the GFAS this year and last year, we had NCDs as one of the global external focus areas in prioritization. And even in the global priorities, which are being proposed for the next term, we definitely have NCDs. So NCDs is definitely a priority in SCOF and in IFMS holistically. So we came up with a manual on cardiovascular diseases, and it is yet to be released. So I'm just going to give you a sneak peek of what it is and how you can use it. So just to go quickly over the table of contents of the manual on cardiovascular diseases, we start with what non-communicable diseases are, and as to something that we just talked about today as well, as to their types, as to what are their causative factors, their social determinants of health, etc. Then we're going to talk about the role of youth in NCDs that Marie talked about. Then we're also going to mention the IFMS Budva Youth Declaration as to what it was and what's its significance. We move on more particularly specifically to cardiovascular diseases. What are cardiovascular diseases and their types? What are their causes, risk factors, and the public health perspective, and the general disease burden. Then we move on. So this is more of a knowledge part. And then we move over to the skills part as to activities, a brief start on how you can start. So in this, we give you a step-by-step explanation of how you can start an activity. May it be a project in community involvement, or may it be a project which is relevant to advocacy. So any sort of activity as to how you can start, how can you research, and then you can go ahead with making a vision, mission, and goal. How can you go ahead, and the methodologies that you should choose to carry out an activity in itself, and how should you give it a good skeleton, how do you execute it, and then we give you multiple options as to what you can do as well. Then we come up to the part on projects and NCDs and cardiovascular diseases. So in NCD, we have an example from Medsa Rwanda about the NCDs health promotion project that they did. And then in cardiovascular disease, we have an example from IFMS Brazil, where they talk about stroke prevention, stroke identification among the general population. So you have a very good example of as to what other NMOs have been doing. Second last, we talk about how to evaluate your activity or how to end your activity. How can you gather feedback, see the impact that you've made, and how you can make your activity better and better. And also to have a compact result as to what impact you've made, to be able to show it, or to be able to see that what the preferred methodology is. Also, just to add in activities, a brief start, we also talk about advocacy and how you can also start with that. Lastly, in the table of contents, we have the externals of the stakeholders, which Sani talked to you about. We talked about NCD Alliance, we talked about the United Nations high-level meeting on NCDs and the processes which lead to that. The next thing which I'm going to talk about very briefly is activities, because we're hopefully going to have another webinar which is very specific to activities after the August meeting, but I'm just going to summarize a bit of the things that have been said. So we do realize that there are risk factors such as which are modifiable and non-modifiable. So your activities can be based on specific risk factors as well. Then we have social determinants of health as to how they influence it, how we need to advocate for it, or how we need to make a change in it actively, and that we need interdisciplinary approach, as all the speakers before me have talked about. A very big thing which we talk about in activities and NCDs is health promotion and health education. And definitely that is one of the most important things which is related to the healthy lifestyle changes, which are which are very tangible influences of NCDs. And also, as what Mary talked about, involving youth and using peer education to not only advocate to the community around us, which we're in a habit of doing, but also to educate ourselves as to what specifically is the status of youth currently, and how we should be able to change it. So these are a healthy lifestyle, but then there are also factors which we cannot control, or which are separate from lifestyle changes separately, and that is what we can advocate for holistically regarding the health systems, regarding the policies which are in place, etc. So now I'm just going to show you. So this is a pyramid of influences or contributors towards any public health issue. So once we start from the bottom down, we have socioeconomic factors, which forms the basis of influence. Then we move on to changing the context to make individuals' default decision healthy, which is the environment primed to make us choose healthy, or is it easier for us to be healthy, or is it more difficult for us because of the lifestyle we live, or because of the policies that are in place? Is it more accessible for me to get fast food, or is it more accessible for me to take a healthy option up? So priming the environment is very important. Then we talk about long-lasting protective interventions, which talk about the healthcare provision and the healthcare system holistically. Then we talk about specific clinical interventions, which happen, of course, mostly after the disease. And then we have counseling and education, which is counseling and educating the people about NCDs in this particular case, or just generally about any disease. So if you see on the right and left, there are two arrows. You can see that the increasing population impact is decreases bottom up. So in socioeconomic factors, the population impact is much more than counseling of one patient alone. And then you can, on the right, see that increasing individual effort. So individual effort decreases bottom up, which means that individuals are more need to put in more effort or conscious effort while they're being counseled or while they're clinical interventions, etc., as to them being a part of the socioeconomic factor. So just seeing this pyramid is very important for us to realize that it's not only the government's responsibility, but it's also an individual's responsibility. And when these two responsibilities meet and are fulfilled, then only can we work towards a world with lesser NCDs and more, just generally a healthier world. So this is just one version of the pyramid, including factors from NCDs. So you can see in the socioeconomic factor, we have social determinants, we have globalization, urbanization, and aging, and corporate behavior. So and this is very important, very relevant in today's world, such as advertising and promotion, product manipulation, and as to just generally how they brand their products, and if those products are healthy or not, and what policies in place. Then we have including NCDs as a relevant topic in things like such as urbanization, globalization, and definitely aging. The United Nations just express, and us even having a United Nations high-level meeting on NCDs does reflect that it is not possible for us to have sustainable development if we have a health system, or if we have a population which has NCDs prevalence as high as we have right now. So it's just not compatible with sustainable development. The second thing, which talks about the behavioral risk factors, is tobacco, alcohol, and unhealthy diet and physical inactivity. The next thing we move on to is obesity, overweight, so particular interventions which will be done when we have these physiological indicators. And then at the top is NCDs as to the causative factors, or in the other pyramid, we also put in specific education and counseling. So I'm just going to give you one example as to one of the projects which are being done globally on NCDs. I don't know if you know this person, but if you're interested in cooking, you would definitely know him. His name is Jamie Oliver, and he is a celebrity chef. He has given a very incredible TED Talk, and I would really recommend you to watch it, which is titled Teach Every Child About Food. And I'm just going to talk about what he's really doing with his foundation, which is Jamie Oliver Foundation, and what actions is he calling out on behalf for the development of NCDs. For the prevention of NCDs. So the Jamie Oliver Project talks about, and these are just a few of the things, or the factors which he's focusing on. The first thing is teaching children about food in their schools as a part of the curriculum. And this is, I think, one of the most essential parts which we should focus on, even if we're doing an activity ourselves, or even if we are advocating for policy changes. Because the first thing is, which Marie talked about, as to how adolescence and how childhood is a very important, especially childhood is a very important age for us for knowledge and for priming us as to how we're going to behave, as to how our lifestyle choices are going to be. So, and secondly, this coupled with the fact that child obesity, there are 41 million children under the age of 5 are obese, a statistic that you've heard over in the WHO Europe stated that 1 in every 3 child under the age of 11 is obese. And these are really, really shocking statistics, which should make us alarmed and worried for the next generation as to what's going to happen. And to prevent it from the beginning or from the base level. The next thing is the percentage of millennials that cook. So one of the reasons why we have unhealthy lifestyles and which have been linked to the percentage of millennials that cook, which is less than 40%. So if how does that work? So basically, if a millennial cannot cook themselves, they will go out and seek out to food that is available to them, and mostly the food that is available to us is fast food, or is food which is not necessarily healthy, or even the food which is healthy is much more expensive than the food which we have available in diners or in restaurants or in store carts, etc. So teaching children about food also increases. Number one, they know what they know about food and the importance of it. Number two, they will tomorrow be the generation which knows how to cook. So there is a very high chance of them to pick up healthy diet for themselves. The next thing is, actually, I'm going to move to the third point. The third thing is advocating and calling out schools to serve healthy food options, and how it is their responsibility to protect the children against unhealthy diets, etc. And then he calls out for the corporate, for corporations, multinational corporations, for corporate social responsibility, such as food companies, which should work on food education, which might be a conflict of interest, but we still think that there should be policies in place which should call out and which should make them liable to work for the benefit of the general population. And another idea is for supermarkets where we buy food, to have food ambassadors which can tell us about basically the food that's there, and about how we can cook healthier food or how we can eat it. And this is the food revolution initiatives around the world. So there are different food revolution initiatives around the world that are being taken. So basically, this is just one example of one activity which is going on around the world, and this only activity is focusing on just one risk factor of unhealthy diet. And even in that, there's so many factors and there's so many things which can be done. So I particularly really like this example, which gives a more holistic view and even on one of the risk factors. So this is the end of the webinar from our side. Now I'm going to move on to the questions, and I'm going to give a couple of minutes for all of you to post your questions. Please feel free to post your questions in the YouTube account, or on the WhatsApp group that we have, or even on Facebook, and we will try to take your questions. Yes. So I'm just going to wait for a while. Okay, so I have one question on the WhatsApp group, which says that NCDs are very vast. How do we prioritize? So I'm just going to open the floor if anyone wants to take up this question.
Maybe this is Marie. Maybe I can say something. I think it's important if you I totally agree that it's a huge area, and it's somehow, in my country, for example, 90% of my population, or the population of my country, dies from NCDs. So I do understand that it seems like we're trying to grasp a lot. I think it's if you want to sort of make change, then it's worth looking at where do you think you can have the biggest impact, and also what level do you want to work on? Do you want to work at the local level and try to change your community or your municipality or something at that level, or do you want to try to change something at the more national level? But at least I think after you've kind of decided that, it might be worth really surveying what are the main issues in your community or in that space where you want to try to change things, and then try to brainstorm maybe with other smart people and figure out what are the potential solutions and what do you think is needed. In some places it's taxation on tobacco because so many people smoke, and in other places the urban structure is really not possible to live doesn't make it possible to live a healthy life, and in other countries or in other spaces it's totally different. There is maybe, if it's a village in a rural area, you might have trouble with access to healthcare. So I think that's worth looking into. And then also, what do you find interesting yourself? What do you think you can keep your motivation going, and where can you find a place to work with people that you enjoy working with and that will keep you motivated for a longer period of time? So yeah, those are my reflections.
Thank you very much, Marie. And I think she's explained very well, but even just giving a bit of the activities perspective, if you're working on an activity on a local level, then yes, it's very important to do your research. If you're just talking about prioritization, but again, if you're definitely talking about advocacy, or if you're talking about an impact on a bigger level, then that would be a different decision skill that you should use. Okay, I'm just gonna check Facebook in the meanwhile. Okay, we have one more question. In short, how do we so in short, how do we advocate on national, local level? I think that's what it is. That's in spelling mistakes.
Okay, may I go?
Yeah.
Okay, so the question is, how do we advocate at national or local level? So just to share my experience as a coordinator on one of our projects, which is being carried out here in my country. It's the same as prioritizing. When you look at the national priority and then you identify what is needed by doing research, as Nishwa said. So the one example is our project is called Youth Education Activities on Health, on NCDs, sorry. Then what we are doing is just we are advocating for monthly sport days in all the university campuses, and also advocating for specific smoking areas to avoid passive smoking, because it's also killing at almost 50% as an active smoker. We are also advocating for kitchen garden in high school, so that high school students can have vegetables in their daily diet. So these are examples of advocacy we can do in preventing NCDs. So yours, in your country, you have also your priority. You can also identify the what is more needed to do in fighting NCDs. Thank you.
Thank you very much. Sunny, would you like to also add your 2 cents on how people can advocate at a national or local level?
I think what Chris mentioned is really valid. And Marie, before that as well, is that you first need to check what actually makes sense to advocate for on your local and national level. What are the issues that are most prominent there and need to be solved? And also, what do you actually like to be advocate on? Because if you're passionate, that will also give more impact, then it's something that you maybe like less. And maybe to add something that we can help with is you can also try to use some of the resources that IFMSA has, such as capacity building, but also the policy documents we have, or the Budva Youth Declaration, for a bit of guidance and a bit of background, as well as multiple other resources that the World Health Organization offer, the Enough campaign of the NCD Alliance that I mentioned before. They offer a lot of examples and also a bit of guidance sometimes to start if you identified your topic you want to advocate on, as well as, of course, the manual that we presented today. They also are a few options included on how you can start. And we're always here for questions as well.
Thank you very much. I have one more question. So Bakam says that I do not picture the difference between formal preparatory and informal preparatory events, I think, which is a part of the global processes and stakeholders part.
Can you repeat the question? Sorry.
So Bakam said that she cannot picture the difference between formal preparatory and informal preparatory events, which I'm assuming. But
Yes.
that's the question.
It's a bit harder to explain without the actual sheet up there, but the formal preparatory processes were the processes that fall under the official United Nations processes, and they are guided by the Secretary General of the United Nations, and they mainly focus on country level negotiations as well as guidance. And actually, that is the formal processes, but because it is not that accessible to civil society, but also to organizations as the World Health Organization, those more, maybe informal wasn't the best word, but the below processes were made, where actually other stakeholders could give their opinion and could share their things they thought were important, but also interact with actual government representatives to get everybody together, which is really hard to get into those formal processes. So it's kind of an extra things designed mostly by the WHO to give more stakeholders than only governments the opportunity to weigh into what we think should be the outcome of the UN high-level meeting.
Thank you very much for this. And I think that's about it for the questions, which I can see for now. So I think I'm just going to wrap up the webinar. Thank you very much to Marie, to Sana, and Chris for being here and contributing to this webinar. As I'm just going to go around if there's any last things which you guys would like to say before we end. Marie, would you like to go first?
Yeah, I can. I think we've covered a lot of stuff today, and I would, if there's anything you didn't understand that I've said, feel free to reach out to me. And also, if you have other questions, don't hold back. Just let me know, and I'll try to answer as well as possible. And as Senna said, there are a lot of resources, but I think we all know a lot, and I'm sure you guys know a lot. So really trying to get down to business and do something is super important. And there's a lot of momentum right now, so it's a great time to talk about NCDs actually. And maybe I just wanted to add actually that I think it's important right now because there's the high-level meeting on NCDs, and that means that some people very high up in high positions in your country is actually super aware of NCDs right now, and they know, at least they know they're going to a meeting about this topic, and they might not have heard about NCDs a year ago. So that's important as well. And yeah, there might be some access somehow. You might be able to contact some government officials and actually get a little bit of influence or insights, something like that. And youth is a nice fresh air to breathe, I think, for some of these politicians sometimes. So yeah, go ahead.
Thank you very much. Chris, would you like to say something? I'm going to move on to Sonia and then wait for Chris.
Yes, I would also like to say to all of you, thank you for listening, and hopefully you learn. And also, please be those change makers. And let us not stop at the UN high-level meeting, although a lot of people are only focusing on that. But after that, let us hold our governments accountable, that they actually live up to the things they said during that one-day meeting in September, and not like we saw in 2011 and 2014, that there were a lot of promises, but not a lot of outcome. And we can really weigh in there as well. So let us just keep on being those change makers. And of course, always there for questions.
Thank you very much. Chris?
Okay, thank you very much for coming, and thank you everyone who contributed. I mean, Sane, Mary, and Nishwa. And I would like to call upon the youth, especially in Africa, to come and contribute to our regional priority, the cardiovascular disease, by promoting health lifestyle. So we have to stand for this and do work on different projects related to NCDs, and because this is this is Africa, the most highly affected region, like more than 60%. So I am calling NMOs to come and help us to work on different projects and come up with our contribution to our regional priority. Thank you very much for watching, and you guys, you are the NCD advocates in your respective countries.
Thank you so very much, Chris. So lastly, I think everyone has said everything which I want to say, but yes, definitely, please do pick it up as a responsibility, be involved in the change that's going on, be involved in being aware as to what's happening, even if you want to start locally or you want to start with the community, and also looking at the bigger picture. Do be the change makers and NCDs, and NCDs is something which is which global burden is just increasing, and it is one of the epidemics of our generation. So it's very, very relevant to us, and we need to make a change, and we need to work for it. So with this, I would like to end the webinar. Thank you very much, everyone, once again. If you ever have any questions, please feel free to reach out to us. And we also have some resources which we will be sharing with you after the webinar. So feel free to go over it, and also keep a lookout for the manual on cardiovascular diseases. Bye-bye.